Rebellious Studio presents the Mind Body Podcast with your host, Maria Angelova. Hi, Rebels. Welcome to the Mind Body Podcast, your rebellious podcast with me, your host, Maria, where it is all about a strong body, calm mind, healing, and fully living. And today it is my pleasure to welcome my guest, Dr. Amy Sarow. How are you, Dr. Amy?
Hi there, Maria. I'm doing well, thanks. How are you?
I am fantastic. I'm excited to talk to you and to have you share with us. I personally think a topic that's not talked about enough. You are the doctor of audiology, and hearing is one of our senses. And you tell me, unless it becomes a problem, I don't think there is enough knowledge about hearing loss and things like that out there. And obviously, you probably think that even more, but I think it's a very important topic because how we perceive the world, how we communicate with the world is very much tied to hearing.
Absolutely. I completely agree. I think that you're right. So nowadays, we have newborn hearing screening. So we check babies when they're born, but between that time and when we're older, most of us don't do a lot of thinking about our hearing unless there is a problem. So it's great to be proactive about your hearing. As you mentioned, it's important for communication, which is important for our overall health. And it impacts us in a lot of ways that we don't think about until we struggle or have hearing loss.
Yeah. So before we dive into that topic, I have to start with 3 words that describe Amy. Who is Amy? And give us a little bit of a backstory behind each so that we can get to know you as a person.
Yeah. Okay. I will think a little bit about some words. I'll tell you in the meantime while I'm thinking about that, some background. So I originally got my bachelor's degree in German. I studied, I'm from Michigan, so I started at Central Michigan. And then after I got my degree, I went over to Germany. I taught English over there for a few years. Then I came back and went back to school, and I was thinking, maybe speech pathology, because that's something like teaching. But as I was taking coursework, I realized audiology is a field, and I became very interested in that. I love the idea of with language communication, and being able to help people to communicate is a fantastic thing to do as a profession. So I was really excited to do that. I went to the University of Iowa. And then I did my residency at Mayo Clinic in Florida. And yeah, I've been working with patients in a few different populations in private practice, and more recently with veterans. And yeah, so that's kind of some information about me. And now I also do some blogging, writing, and hearing healthcare advocacy.
Okay. Did you want to add something? Sorry, I didn't mean
to. I'm trying to think of the 3 words. So I am definitely, one word I would say is an introvert. I'm more of an introvert. I would say that I'm a positive person. So I always like to see things, see the bright side, see the glasses half full. And let's see, one more word. I guess I would say I'm a hard worker.
Okay. Let's go back to, I have almost a minor in German. I can't say anything in German, but I'm almost there. When we talk about languages and communication, our words are only a small portion of our communication, right? Our tonality and our gestures, our body language is a huge part of that. And when you can see somebody, it's a lot easier to communicate with them versus when you get a text message and you can't hear tonality, or when we had the pandemic, people were, with masks and you couldn't see their faces. And I would imagine for people who are relying on that, on the body expressions, do you see a smile, a frown, that made it harder to communicate. Let's talk about well-being, mental health, and loss of hearing.
Yes, definitely. During the pandemic, there were so many people who were either noticing, oh, I think I have a hearing problem, and I'm really aware of this now because of the mask that's making it hard. Even people with normal hearing would be struggling. There's plexiglass, there's a mask. It's just very difficult. And we're humans are just social creatures. We need interaction with other people, whether it's our friends, family, coworkers. um it's just normal and healthy for us to have that on a daily basis, and so many of us didn't have that, and it led to people feeling isolated, and just yeah, it certainly affected their mental health.
What you started the conversation with, starting that babies are checked their hearing, for their hearing, the quality of their hearing. But then, is there certain tests that are recommended that you should request as you're aging to have done? Or is it mostly a reactive type of thing where you go and you're like, I don't think I hear as well, and then you get tested?
Yeah, so I encourage people to be proactive about it. It's always good to have a baseline hearing test. For patients, I would always encourage that by age 50 to have a baseline test, even if you feel like you don't have any hearing problems, because it's useful going forward, screening or retesting as we age, to just keep an eye on that, because it's important, as we're talking about, for mental health, for overall wellness. When our brains don't have to work as hard to understand the conversation, and we can focus more on, like you mentioned, the tone, the semantics, other things going on in the conversation, we're more fully engaged in being able to participate. So I would say anyone can have a hearing test. And another topic, which you might be getting to this later, is younger people. Actually, we're seeing a lot of younger people developing noise-induced hearing loss. So young people who are, let's say they have loud hobbies, going to the gun range, or other recreational activities, maybe a loud job, or they just like to listen to headphones all day at a loud volume. Those would all be good reasons to just say, maybe I should just check in on this now and then, because I didn't, I want to keep my hearing.
And I was going to ask you about that. If there is such a thing as called as hearing hygiene, is the word that comes to my mind. Is I will tell you, I'm guilty of that. Is I like to listen to music loud with my earpods when I go running, and I'm very intentional to turn it down. And I'll tell you, my dad used to be on my case years ago when I was young, and he would always say, "Don't put too loud music into your ears." But can you talk a little bit about that? Because I think if there was an issue back when I was a kid, which was quite a few years back, now it's a thing. I mean, the kids are constantly with the earpods, constantly with, listening to music or on social media. And I'll tell you, sometimes my daughter, like, her volume is so loud that I can hear through, her earpods. And I'm like, baby, like, that is not good. Can you comment on that? And kind of like, is there safety practices, so to say, to how loud the volume should be? I mean, I'm sure it's subjective to everybody unless it's measured.
Right. So that's absolutely true. So a lot of people don't have an awareness of, what does this decibel level sound like? Which, if somebody does want to know what that is, there are free apps you can download on your phone. There's one called NIOSH, which is really good. So I'm more of a nerd with these types of things, and I like to do that now and then, but it's available for everybody. In general, if you're listening with headphones, you want to keep it at 80 decibels or below, and not for hours and hours. If you max out the volume on a phone, the FDA does not control the volume. And we've measured this actually in people's ears when they turn it up high, and it will go over 100 decibels, which can cause damage in 15 minutes or less. So there are controls on your phones in the settings where you can reduce. So let's say you want to turn it all the way up, it's your favorite song. Even if you max out, you won't go above, 70% of maximum. It's a safer level. So
So
that's
So is that like the sound setting? Is that what you're talking about? On the setting sounds where you can turn it down? Is that what you're talking about? And it's like half the way or the 25% of what the max is? Is that what you're?
Exactly. Yep. So I know that this changes when Apple, I'm an iPhone user, when they update the systems, it changes a little bit every time, but there are settings in there that you can use to reduce it. On Android, I'm not sure, but there must be in their settings that you can limit that. Now, if you're listening with earbuds or headphones and they're not noise canceling, you should be able to hear a person at an arm's length from you over what it is you're listening to. Yeah, so if you have it turned all the way up, you won't be able to hear that person. So that's a sign right there that's too loud. If you have noise canceling, it's different because that is going to block out the sound. But for your average earbuds, that's a good rule of thumb.
Yeah, that is a good advice. Anything else that we can do for good hearing hygiene?
Yeah, so limiting the sound is helpful. I like to think of noise exposure kind of like sodium intake, which we think about, or sun exposure. Some is okay, that's fine. But if you go above a certain level, it's going to be not good for your health. So just thinking about having an awareness is the first step. Am I in loud environments? If I am I protecting my hearing, putting on earmuffs or earplugs, some type of hearing protection, or could I limit my time in that area? Or if the volume is in my control, can I turn down the volume? Those are 3 good things to do.
Too. Okay, let's go into another topic, which is the topic of, and people may not relate hearing with that, but dizziness, vertigo, disorders such as that. I personally have vertigo. It's a very unpleasant thing to have, but can you talk a little bit about that? And if there is any, like from your perspective as an expert, is there anything that we can do to help with those?
Mm-hmm. Yeah, so audiology has the ear has 2 parts to it. We've got the hearing portion, we've got the balance portion. So it's an area of audiology that people don't always know about. The inner ear helps us to keep our balance. And when something is wrong in one ear, in certain cases, we can get the room spinning sensation, things are spinning around us. One of the most common types of vertigo is called BPPV, which is, we call it the crystal condition also, where you have it's almost like a piece of sand or a small grain that gets loose into one of your balance canals. We have 3 on each ear. And then when we maneuver it back into place, that helps the vertigo to go away. So that would be the most common form. Vertigo is different than dizziness, which we can feel dizzy if let's say we're dehydrated or stand up too quickly. You might feel lightheaded. That's different than vertigo, which is related in most cases to the inner ear.
And when you talk about the process of getting that crystal in place, is that like a manipulation that is done?
Yeah, so it is actually. There's the most common one is if it's in the back canal, it's called the Epley maneuver. And this can be done by a physical therapist, audiologist, some general practitioners are familiar with it as well. And essentially, they just guide you through a few different movements where you lie back and roll over and then sit back up. And once you do that, it helps to put that crystal back where it's supposed to be. And so luckily, it's something that it's not fun to have that, but it can be pretty easily cured with a repositioning maneuver.
Have you ever heard of Pilates being helpful for vertigo? Because that is what I practice, and I do think that is something that's helping me. And it's again related to balancing the body if you're off balance and rebalancing the body. Have you heard as an expert and a professional about that?
So I haven't heard about that specifically for vertigo, although there are some, if someone has imbalance or disequilibrium, or let's say they have a vestibular weakness on one side, exercise is fantastic to help just retrain the body, recalibrate it to the new normal. If you do have a weakness on one side. With vertigo specifically, it may depend on what the cause of the vertigo is, but overall for balance, yes. And I'm sure Pilates would be great because you're working on strengthening the muscles and, spatial awareness as you're moving. So certainly I could see that as beneficial.
Okay. Now let's talk about, unfortunately, maybe something goes wrong with your hearing. Now what? I would say I personally have a story. My grandma used to have hearing loss and my great uncle did. And back in the day when I was little, the solution was you speak to grandma really loud. And few years into it, I guess here I'm from Eastern Europe, so maybe we were a little bit behind of times. My aunt got her a hearing aid and it was this big thing in her ear that was attached to her ear. But I'll tell you, we as kids did not like it because we used to be mischievous and grandma would never know. And then once she put that thing on, she could hear us like from the other room what we were whispering. And we were like, oh, that is not a good thing. And I know hearing aids have gone a long way in terms of like presentation and the way they look. But I think it was from one of our conversations, it was a stat that you said that about 30 million Americans have hearing loss, and only 30% have seek some kind of treatment, which is disturbing.
Yes, it is. It's a lot of people. And also looking ahead to 2060 or, decades from now, we're expected to almost double or perhaps more than double that number. So yes, there are a lot of people with hearing loss, and most of us know someone, a family member or a friend, coworker, somebody probably that has hearing loss. So there are a lot of things that are maybe preventative or prohibitive for people to seek treatment. So you mentioned that, visually things have progressed. I'm sure that the hearing aids looked very different when your grandmother had those than some of the options we have nowadays. So hopefully another thing that we're working on is to have some of these stock images that you'll see in newspapers or magazines. They show like a really large hearing aid that looks older, whereas today they really do look more sleek and modern. They're kind of like miniature computers. So I know there was this Wall Street Journal that just came out about actually millennials and younger people being more accepting of hearing aids, which I see that as very positive. That they're maybe more open to considering something that would help with hearing. So I hope that is going to get better. And I think it's with over-the-counter options as well, people feel like, okay, maybe I could try this out. If they're more comfortable doing it on their own first, maybe they try it. Maybe it doesn't work, but then they perhaps choose to seek help from someone else. So I would love to see those percentages go up, but yes, you're right. There are a lot of people that haven't sought help.
In terms of the hearing aids, which are over the counter, I kind of think that's a little bit scary when you don't know what you're doing. Is there anything people should pay attention to or be aware when they're choosing to self-treat their hearing loss?
Yes. So with over the counter, it's going to be only for adults. So children should not be thinking about that, or families thinking about it for their kids. It's also best for somebody who hears about the same in both ears and has a mild to moderate hearing loss. If it's a flat, moderate hearing loss or more, you'll need something prescription level. And so I always recommend to people have a comprehensive hearing test, because then you'll know, okay, what is my hearing? And then okay, is this a good option for me or maybe not? Also, someone needs to have good dexterity and be comfortable reading instructions and implementing them on their own without, assistance, because it is a self-fitting procedure. Also being able to use a smartphone.
To link it up.
Mm-hmm. Yeah, because you'll need to be able to adjust it yourself. And of course, some medical contraindications would be anybody who has, middle ear or infections going on. If you hear very differently, again, from one ear to the other, that's you should have that looked at, because there could be something else medically going on. Or someone with very narrow ear canals. If you're someone where you put in earbuds and they don't fit, your ear shape may just not be conducive to that type of device.
Devices. Are there any poor quality devices where I'm just imagining it's just like earpods, you put them on and some of them have such poor noise canceling that there is so much almost like buzzing into your brain because the quality is so bad? Is there such a thing with hearing aid as well? Is that something to pay attention to and be careful with?
That is. So actually, I have been testing out some devices. I ordered, a popular one on Amazon, and I've been testing a few different ones compared with some of the other, I would call them reputable, good quality over-the-counter devices. And when I put them in, I have a test box over there. When I put them in the box, you really see that in noise, they do nothing. So they're amplifying the noise, they're amplifying speech. That is not going to be very useful for someone who's in a noisy restaurant or noisy environment. They can be beneficial. Let's say you have a grandparent who's maybe in a care facility, and they need something in a situation where you come to visit them, or there's fear of losing it, something like that. And there's not a lot of noise going on. Now, maybe that works for that person. But for the average person, it's probably not going to be the best option.
Okay. Yeah. So things to pay attention to, because it's important. It's your hearing. And, as I was thinking about our episode, do you ever watch Dancing with the Stars?
Yes. Yeah.
I remember, I think it was it now DeMarco, who was deaf, and he was dancing. And on one of the episodes, they actually turned the music off so that they can give us a sense of what it is like for somebody who does not hear to dance. And it was crazy, because you hear the music, you feel the rhythm, right? It gets your blood pumping. And then when they turn it off, it was just silence. And it was astonishing how he kept up with the beat. I don't know how, but it was impressive.
Yeah. Sorry, that's my dog over there.
Oh, that's
I don't know if you can, I don't know if you can hear him, but
no, it's fine. I just thought, wow. I think with hearing, I deal with a lot of people with pain, and I talk to people a lot about movement. And I tell people a lot of times you don't appreciate the fact that, we can move our finger like that. It just moves.
Yeah.
Like one day something happens and you're like, oh my gosh, I can't believe how much I use that finger, or what it takes to move that finger. And I think it's that same thing with hearing. The way you perceive the world, the way you relate to the world, the way you feel the world. Such a powerful sense.
Absolutely. And I know from, cochlear implant activations, there are some of those that you see on YouTube where they're just like, this amazing moment where this person can hear, or this child can hear for the first time. And yeah, and not everyone in real life is, is that dramatic, but I've certainly been in some where the person, it was a granddaughter with a grandfather, and it was turned on for the first time, and normally he couldn't hear anything, and she just said something to him like, Grandpa, I love you, and he said, I love you too, or something like, and I was just like, oh my gosh, this is, that's the reason why I love doing this. But that's just, it's so amazing. And they were both just so touched, like, wow, you're able to hear me. This is amazing. And it's those things that we don't think about until, we have a problem. Like you said, that you're thinking about, I'm just hearing conversation. It's just normal, but it isn't for everyone.
Yeah. Amazing. And, I think hopefully this episode is a reminder for everybody to take care of their hearing. And if there are concerns, to address them. Actually, let's quickly touch base on that. If there are concerns, suddenly, I don't know, you wake up and suddenly like there is muffling into your ear, you don't hear, what's the best thing to do?
If you have a sudden change in hearing, so if you wake up and you can't hear out of one ear or it's very muffled, the first thing you should do is reach out to an ENT in your area, because that is kind of an emergent situation. You need to, if there's a chance to recover hearing, you need to be seen and to figure out, okay, so what is causing the hearing loss? If it's from the inner ear, sometimes there are medications that they can give to bring hearing back, but it has to be given within a certain time frame. So within ideally the first few days of the occurrence. So that's something I would say to anybody. If that happens to you, reach out right away.
Oh, wait. Yeah.
Yes.
Amy, thanks so much for all the great info. Let's start wrapping up by you giving us a favorite quote or a piece of advice. It doesn't have to be related to hearing, or it can be your choice.
A favorite quote.
Or a piece of advice.
Yeah. Yeah, I would say in general, so I don't have anything really audiology related, but I would say if there's something you feel passionate about changing or doing in life, I would really encourage people to go for that and not wait. Because I think when you put the time and the attention into something, it's amazing at what could happen. I know from my own experiences, I've been getting into blogging over the last year. I've just been amazed at like the opportunities and things that come up when you start to put yourself out there, and for positive change and to help people. So yeah, so that's what I would say.
And I love how you started with the word. You were obviously very passionate about what you do, and I think that's so important. And when you put that passion out there, I think it just amplifies and it becomes contagious. So I'll totally second what you said.
Yeah, there we go. Amplification. So come back.
Yeah, look at that. That's what you started. That was totally unintentional, but there. Amy, what's your definition of rebellious?
Rebellious. Let's see. It's when you know what the rules are, but there may be times when you need to take a stand and stick to your convictions, I guess.
Like that. Amy, where can people find you? Where can they follow your work, your blogs? If they have questions, how to reach out?
Yeah, so you can visit my blog, which is my name, amysarow.com. I'm also the lead audiologist at soundly.com, where we help people to get good information about, should I get this hearing aid or that one? What about cochlear implants? So there's a lot of good information on there as well.
Okay. Amy, thanks so much for your time, for sharing your passion and knowledge. Again, I think a very relevant and not talked enough topic. So thank you. Appreciate your time. If you guys have any questions, please feel free to ask them. Thank you for tuning in. And of course, make sure to stay rebellious. I will see you next time. Thanks, Amy.
Thank you.
Can't get enough of those rebellious conversations? Do make sure you subscribe, like, and share.